I've lost feeling in my feet. How many people know about diabetic peripheral neuropathy? We have an entire generation, a tsunami, a silver tsunami they're calling it, right? The silver tsunami consists of the end of Korean War veterans and Vietnam veterans. Vietnam veterans were exposed to Agent Orange. Agent Orange causes peripheral neuropathy, a loss of feeling in your peripherals, right? Your hands and feet. When you can't feel your feet, you don't know where you are in space, period. I have a patient, I have a friend who died in December of last year. He was a Vietnam veteran. He was exposed to Agent Orange on the flight line every day for 4 years. He went to the hospital for a fall. He spent almost the entire year in the hospital in rehab. He came home. He couldn't feel his feet. He was on dialysis. He came home. He told me he was coming home. He didn't have a caregiver lined up because of the stupid VA program that he was on. He had to find somebody. He's home for 1 day. I went to visit him, and I said, I'll be back in 2 days. I called him to come back in 2 days, and no answer to the phone. So I'm like, okay. I checked with his sister. His sister didn't call me back. 3 days later, his sister calls me, and she's like, I'm at the house. Pat's dead. Pat was in a power wheelchair supplied by the VA. He couldn't feel his feet. He came home from dialysis. He had his phone in his hand. He dropped his phone. When he leaned forward, his knees bent. His feet went off the feet plates. His body went down, and he ended up strangling himself with a seatbelt. That's how he died. Because he couldn't feel his feet. He couldn't feel to push with his legs. These are real things. These are real things. This still kills me. I take medication that makes me lightheaded or tired. I take medication that helps me sleep or improve my mood. These are real things. These are real medications that your patients take. And if they take 5 or more medications, they're already considered to be a fall risk, which is another diagnosis that we can use to go into the home and help these people prevent falls. Okay? The last one, I often feel sad or depressed. These are people that live alone. You should be telling, if you have somebody, if you take care of people in their home and they live alone, every single county has a way of registering people as a senior who lives alone. Okay? That way they can put a lockbox on the front door. They can tell them that they're going to have a garage door opener so that the people can get in. I am so passionate, and I'm so we do this for a reason, because for 15 years as an occupational therapist in my role, going into homes, I was expected to exercise the falls out of these people. This is what happens when a Med-A home health agency is expected to go into the home. The patients think that we're just going to go in, we're going to exercise them, they're not going to fall, we're going to be there for 35 minutes, we're going to be typing on the computer, we're going to completely ignore them, and then we're going to leave, and then they're going to go back to watching their soap opera or whatever. It is a play that plays out every single day in every single home in our area. There is a reason that Medicare is going bankrupt, because this doesn't work. It doesn't work. We go from spending $5 billion to $6 billion to $17 billion on falls. We're not looking at the reason that this doesn't work. It doesn't work because therapists are getting paid to complete these visits. I'm sorry if you own a Med-A home health agency in this room, but it doesn't work. It doesn't work. The Med-A home health agency with a nurse going in to check medications is 14% effective in reducing falls. The therapist who wants to exercise the falls out of these patients is 17% effective. A comprehensive assessment by my company going in and supplying these patients with resources in the community and recommendations for what should be done to make their home safe is 61% effective in reducing falls. That's a big difference. We are twice as effective as what's going on with Med-A right now. Okay? Now, as an OT in home health, one of the reasons that I don't work in home health anymore is because I used to have PTs that would go into the home to do what's called a starter care, an oasis, and they would say, the patient doesn't need OT. We're just going to go in and exercise them and get him walking better. These patients are walking around this home that has obstacles. It has ottomans. It has a chihuahua that's going to chew your toes off. It has bad lighting. It has narrow doorways. It has narrow hallways. We're trying to get these people to exercise in the worst possible environment.